Shifting focus to the global Mpox outbreak. Cases of the viral infection are rising at an alarming rate across Africa. Over 18,000 Mpox cases have been reported in Africa this year, with 16,700 cases and 570 deaths in the Democratic Republic of Congo. About 1,400 new cases and 24 deaths linked to a new variant of Mpox have been reported in the past 1 week.
As far as we are concerned, in the DRC, 16,700 cases have been recorded. These are the latest figures, and just over 570 people have died. What's new about this disease is that it's affecting more and more young people. Many children under the age of 15 are affected. I would remind you that the main means of contamination is direct contact, contact with animals, and sexual transmission.
African health officials have appealed to the international community to not impose travel bans on countries dealing with an outbreak of Mpox, but instead support African nations in testing and rolling out vaccines. The head of Africa's Centers for Disease Control and Prevention said Africa must not be punished.
For a coordinated response is now greatest in the African region. The Africa Centers for Disease Control and Prevention declared an Mpox continental emergency shortly before WHO's global declaration. Europe must choose to act in solidarity. Solidarity with individuals and communities impacted by Mpox, by working directly with them to take charge of their own health.
African countries could start Mpox vaccinations within days from now. The Democratic Republic of Congo, the worst affected country, hopes to receive the first Mpox vaccines by next week.
The population protection has changed, the virus has changed, and all of this is occurring in that part of the DRC that is politically unstable and is in the middle of a war. So the healthcare services have collapsed. We can't even get the samples to the labs there. So more than half the patients are being diagnosed clinically because we don't have lab results. So you've got all of the problems together. in this sort of perfect storm.
Kinshasa wrote to Japan requesting for doses of Mpox vaccines and needles manufactured. Japan-based KM Biologics says one of the two manufacturers widely used Mpox vaccines, and Denmark's Bavarian Nordic makes the other vaccine called Genios. Now, the United States has promised 50,000 vaccine doses for the DRC, while Japan will send 3.5 million doses. This would help address a huge inequity that left African countries with no access to the two shots used in 2022 global Mpox outbreak, while vaccines were widely available in Europe and the United States.
I sincerely hope that the vaccines will arrive next week, so I can give you a rough idea of the timing. I hope that the vaccines will arrive next week. You know, it's really a whole logistics chain, from our acceptance first and then a few administrative procedures before shipment. But our strategic vaccination response plan is already ready. We're just waiting for the vaccines to arrive. We have in fact written to Gavi asking them to make vaccines available to us, and we have agreed to this.
The World Health Organization has stressed that Mpox, regardless of new or old strain, is not the new COVID, as authorities now know how to control its spread. Earlier this month, the WHO declared Mpox a global public health emergency for the second time in 2 years, as a new variant of the disease, known as Clade 1b, spread rapidly in Africa.
Mpox is not the new COVID. Regardless of whether it's Mpox Clade 1, behind the ongoing outbreak in East Central Africa, or Mpox Clade 2, behind the 2022 outbreak that initially impacted Europe and has continued to circulate in Europe since. We know quite a lot about Clade 2 already. We still have to learn more about Clade 1. We can and must tackle Mpox together, across regions and continents. So will we choose to put the systems in place to control and eliminate Mpox globally, or we will enter another cycle of panic and neglect? How we respond now and in the years to come will prove a critical test for Europe and the world.
Apart from the Democratic Republic of Congo, the new variant has been detected in Kenya, Rwanda and Uganda. Mpox cases have been reported in Sweden, Pakistan and the Philippines as well. The first signs of its spread outside Africa this year. Passengers were being screened at international airports in Pakistan's biggest city, Karachi. Airports in other Pakistani cities were also keeping up with checks and disinfectant measures, after authorities confirmed a case in a patient who returned from a Gulf country. The Indian government has also issued a high alert across airports, ports and borders to monitor incoming international passengers for signs of Mpox. As cases of the viral infection grow, countries across the world are gearing up to deal with the latest public health emergency, even though the WHO has assured that there is no need to close borders or impose travel curbs. Several countries have heightened surveillance. Now, will Mpox trigger a COVID-like shutdown? For more on this, we have with us Dr. Gitinji Gitahi, who is a global CEO for AMREF Health Africa, which is Africa's largest international NGO on health. And he is also a part of the Africa Union Pandemic Preparedness and Response Commission with the Africa CDC. Welcome to Firstpost.
Thank you very much.
Now, Doctor, can you provide an overview of the severity, the spread of Mpox? What is the current status of the Mpox outbreaks in the affected regions?
Well, we know that since 1970, Africa has been grappling with the Mpox infections, and most of these have been limited to the Democratic Republic of Congo. And last in 2022, there was an outbreak of that particular virus to countries, but then that quietened down. But Congo, DR Congo, has continued to fight this particular infection until now. But more recently now, we have seen that there's a variant, which we are calling the clade 1b, which has now gone and increased in terms of virulence, in terms of the ability to infect, and has spread out beyond DR Congo to other surrounding countries, Kenya, Uganda, Rwanda, Burundi. What we have seen is that so far we have about 18,000 cases this year, which exceeds the cases last year by a big margin. When you look at this is half a year, and last year was a full year. So we've exceeded last year's half year, and yet we still have the several months to go. Secondly, the deaths have are more than 540 right now, with the last 1 week having more than 24 new deaths. In countries where the outbreak has been declared, like Kenya, Uganda, there are 1 or 2 cases. So we don't have a huge explosion of cases. Okay. We still have in the range of 1 to 2 in the countries that are declaring an outbreak, other than Congo, where 96% of the cases are.
Talk to us about the seeming inequity, where we have countries like the US and European countries who had easy access to vaccines during the 2022 Mpox outbreak, but the countries in Africa where the virus was spreading were facing shortages of the shots.
This is the situation we found ourselves in during COVID, and there has been the exact repeat of the exact circumstances. We know that out of all vaccines that have been given across the world, the US is the most vaccinated against Mpox. Yet, DR Congo still has 90% of the 96% of all the African infections, and Africa has more than 42% of the ever global cases of Mpox. But yet, the US has vaccinated more than 1.2 million doses. Most of the stockpiles are in the US, more than 500,000 vaccines. There are no vaccines in Africa where actually the outbreak is based. So this is back to inequities injustices, and I think we must call it out and say we do not want to go back to COVID. We want to end these injustices because Africa now needs the vaccine. We need 10 million doses. We have been promised about 250,000 donations out of the needed 10 million. And we don't even know when those 250,000 will come and who they're going to vaccinate because it's such a drop in the ocean. So we must call, again, this discrimination. We want, the vaccines to be provided. We want actually Africa to get together and with its partners to ensure vaccines are available, but the money is necessary. But this is not just about Africa. We must say that if Africa is unsafe, the whole world is unsafe. So vaccinating African people is protecting the world. So people must stop looking inside and know that actually the danger lurks outside their house. And therefore, we must look beyond our house to ensure that the world is safe. We don't want a repeat of COVID-19. We want vaccines available to everybody, everywhere, not only in Africa, right now.
And Doctor, in terms of the effectiveness of the measures such as surveillance, contact tracing, vaccination, as we've touched on, and the public health campaigns that are crucial for managing an outbreak such as Mpox, how effective are the control measures that are in place in curbing the Mpox spread, or does more need to be done in your view?
Countries have started working on disease surveillance. Countries have started, the ones that have declared outbreak, they're doing significant efforts in contact tracing. Some of the countries like Kenya, I think more than 350,000 people have been traced from that one case and tested. Border crossing areas, there is a focus on them. But of course, there is more that needs to be done. We need resources to ensure we reach every community, every household. This will require that we engage our community health workers who are the ones who are closer to the households. The second thing is that with this contact tracing, there needs to be testing that is rapidly available. What we've seen is that samples are being collected, but the time from sample collection to actually the diagnosis and confirmation is long. We want to see a situation where when patient suspects are identified and samples are collected, you can get results within 12 hours and maximum 24 hours, because then you know what to do with that particular suspected case. We are seeing significant delays because the testing areas that are PCR, that are approved to test Mpox, are far and wide, and also the transport of the samples are not easily done because we may lack what we call the virus transport medium as well. So there are challenges, but the governments are doing a lot to ensure there's adequate contact tracing. And there are successes, but there are also challenges.
Yeah. Right. And considering the ethical, the economic, and the practical implications of travel restrictions to prevent further spread of the virus, what considerations should countries take into account when implementing travel bans related to Mpox?
The point is that there should be no travel bans at all. We are clear on that. There should be no travel bans. There should be no travel restrictions. There needs to be stricter border crossing surveillance. This is what the international health regulations asks for, because you cannot contain a virus. A virus doesn't have a passport. So even stopping people from traveling, it is actually discrimination. And what that does is that it stigmatizes countries, stigmatizes citizens of different countries. So for us, there should be no consideration of any travel ban. What the world needs to do is work together to ensure it can actually reach every single possible person infected, take care of them, and then provide protection for their neighbors, for their households, so that we protect the world. And that means collective effort to keep the virus at bay, not to hide behind our borders. That is not acceptable and is actually against the international health regulations.
Yeah. Dr. Gitahi, thank you very much for being with us on Firstpost Africa and for your valued insights on the latest on Mpox.
Thank you very much for having me.
Climate change is on our doorstep. It's time for a revolution to take root. And it starts with 1.4 billion Indians. It starts with one tree for humanity. One tree for Mother Earth. One tree for a future. Project One Tree, a News 18 network initiative.
On this today, the T20 World Cup bandwagon has moved across to the West Indies. What can we expect